Hi, this is Dr. Greg with ExpressDentist, and I'm here to talk to you a little bit today about some of the common mistakes that people make when it comes to oral health. Oral health is very important. Obviously, it's linked to our physical health and to our mental health, and it's been shown to correlate with a number of different conditions in the body, from diabetes to cardiovascular disease to stroke and so forth. So it's something we want to really pay attention to. And sometimes it's just the little things that make a big difference. If we just have small tweaks in some of our habits, it can make a significant difference. So we're going to run through at least 10 mistakes that we see people make. And some of them you may identify with very quickly. But number one, spending just not enough time brushing. So it's easy to rush, right? 30 seconds feels like forever, but you really want to spend that 2 minutes. And think of the mouth as 4 different areas. So the upper left, upper right, lower left, lower right, divide it up into those sections and give them 30 seconds each. And that will really help you break it down. You can even use a timer on your phone. That can be a useful way to do it. And then another problem that we often see is that people store their toothbrush improperly. So maybe they stick it in a drawer, lay it down, put it in some type of a container so it doesn't dry out properly. And another one is putting it too close to the toilet. It really shouldn't be within 6 feet of a toilet because there is an aerosol that occurs when a toilet is flushed. And so we don't really want that all over our toothbrush. And then another common mistake is to have something acidic, some type of, say you drink some orange juice for breakfast and then you run in and brush your teeth. Now that acid is on your teeth and it can take up to 30 minutes or more for the pH of the mouth to neutralize a little bit. And so if you go in and start scrubbing on your teeth, it's like an acid wash and it can damage the enamel. So you want to wait, if possible, a little bit after eating or drinking to actually go in and brush your teeth. And then speaking of toothbrushing, we often don't change our toothbrush frequently enough. So every 3 months or whenever it looks frayed. So put a reminder in your phone or get a subscription type toothbrush, whatever works for you. But make sure that you're changing that head every 3 months. And then I mentioned frayed bristles. So this is another mistake that people make. If the bristles are frayed, that means you're brushing too hard. So we're not scrubbing the sink. We are brushing our teeth and gently brushing away the soft plaque off the teeth. So if you brush too hard and scrub, it can certainly wear down those bristles, and that can be very abrasive to your gums and cause gum recession to occur. And then again, staying with brushing just once a day instead of twice. You really need to in the morning because we've got a heavy plaque layer because our saliva flows down 90% at night. So bacteria grows. Really need to brush the teeth in the morning before we start the day. We need to go to bed with clean teeth again because that saliva is going to drop. It's going to drop 90% during the night, and that's a cleansing action that occurs with saliva. So you want to make sure that you're going to bed with clean teeth. And then, some people just use the wrong kind of toothbrush, and you've got to be careful. These days, most of the toothbrushes that you get are a soft bristled nylon, but there are still some firmer bristles. And if you combine a really firm bristle with scrubbing action, you are going to do some damage to your gums and to your teeth, and that is not good. So those are a few of the mistakes related specifically to brushing. Now, moving on, flossing. It's easy to skip. You figure, okay, I'm using an electric brush or I'm brushing twice a day. I don't need to floss. That's a mistake because a good third of your tooth surfaces are between the teeth. And so if you're not flossing, then you're leaving the plaque on that part of your teeth. And it's kind of like taking a shower and choosing only to step halfway in. You want to be careful about that. And then another mistake that people make, which they may not relate to oral health, is just not drinking enough water. But it is important to drink water because your saliva is primarily made of water. And so there's a flushing action with the water itself, but it also helps generate saliva, which again helps with digestion, helps lubricate the mouth, helps keep things clean. And then last but not least, a mistake that's often made is just not keeping up on dental visits, especially preventive visits where you go in and have a cleaning and a checkup and get some digital x-rays. This is a really important step because it's where the smaller problems are identified and how the hygienist and the dentist can help you maintain your oral health over time. And they can also discuss whether you have issues like recession from brushing too hard and really coach and personalize so that you can maintain your oral health at the highest level. So it's just a few common mistakes we see people make. And again, sometimes just correcting one or two things can make a huge difference in how things go for you. And at ExpressDentist, we have a trusted network of dentists and specialists across the nation. So if you're looking for dentists, we can help you out. Just give us a call and we will help you find the right match in your area so that you can stay on top of your oral health. So take care and all the best.